Hi, so I just wanted to do a quick video on how to effectively use the MIMS, the paper copy of the MIMS, so that we can all teach this to students and be quite collective and have consistency on how we're actually using the book and what the things are that they need to specifically see. So I've got the page here open in the index at H, and then if we actually go down to heparin, we look here and the one that stands out is this one in bold. So the reason being is because if we look at the top here, it actually has the brand name is in bold uppercase, yet the generic name, which is actually what we need to look for, is in light italics. So going back down again, we always look for the generic name, but I guess unfortunately this book is, it's a commercial book, and so the bold name is what these big pharmaceutical companies, they can actually pay to be in bold. So if you're looking here, you see Pfizer, it's a big company, they've got the money, they can afford to be in bold, but that doesn't necessarily mean that all the information is going to be on that page. The information that we're looking for is actually going to be on the generic name, under the generic name. So what I really want to highlight to students is they need to start learning to almost read between the lines a little bit. Their eyes naturally going to go to this brand name. That's because this book is used by doctors and they can quickly look this up and then they can go and look up the prescriber info and prescribe that. But if we look at the brand name, it's on page 131 here in this book. But they need to look below that and see the generic name, heparin sodium, and we have a few different brands that then come up. So you've got DBL heparin sodium, and you've also got your heparin sodium injection Pfizer. So then students need to realize that heparin's not just going to be on 131, it's also going to be on 128 as well. And I guess that's the first thing that I see many students struggling with, is that they don't realize that the heparin that we're looking at is also going to be on a couple of pages. So if we then turn back in the book and we find our 131 and our 128, that's when we'll be able to realize, learn where the heparin is going to be. So it's going to be between this page here, 131, but also back to this page here at 128. Now, if students did just go straight to the 131, all they're going to find on the brand name is this small amount of information here. So yes, it stands out. It says heparin sodium injection because our brand name is now in the bright blue and it has our generic name heparin sodium here afterwards, but it's only saying a small snippet of information. So use, it's an anticoagulant and for treatment of thromboembolic disorders, that's great. But if we want to know our contraindications, precautions, and adverse and interactions, it says here see equivalent brands. And this is what a lot of the students struggle with, is then going, where do I find this extra information? So if we then turn back to 128, when looking at 128 and going through, we've got some other anticoagulants. You've got your warfarin, your Coumadin warfarin, but if we actually look down here, we've got the DBL heparin. And so we've got our heparin sodium here, and this has all of the relevant product information now. So the students can then look up, when they've found that we've got everything we need to know, we know that it's on a couple of different pages. So this is the one that we're going to use to actually get that specific information that we need. Use, it's an anticoagulant. What does an anticoagulant mean? It's designed to prevent blood clotting, but it's for prophylactic treatment of thromboembolic disorders. So students need to understand that they're not just reading off the words, they need to understand what that means. So prophylaxis means to prevent, prophylactic treatment, to prevent thromboembolic disorders like a DVT, for example. So they could explain that to the patient as, we give this because you're lying in bed and you're a bit immobile for the time being while in hospital, we're giving you this injection to prevent the blood clotting and forming DVTs. So essentially, we're helping any complications of the patient being in bed and forming blood clots. So we next go on to the contraindications, and it's the main contraindication is actual or potential hemorrhagic states. Now students can read that off, but we actually want to know that they know what a hemorrhage is. So we want the student to be able to say the contraindication would be bleeding, actively bleeding. So anything to do with a bleeding deficiency like haemophilia, or any type of acute bleed that is going on. In terms of precautions though, we're going a little bit further down. Sorry, let me move down the page here, a little bit further down, and we need the students to understand and make it relevant to the patient. So it's not for IM administration. We need to avoid the drug in patients with a vascular injury, obviously if they're allergic. In terms of ulcer history, this is a good one to help students understand. If someone had active GI bleeding from esophageal varices or any type of esophageal ulcers, then we wouldn't give heparin in that case. But if they had a history of it, meaning that they've had a history of ulcers, but they're not actively bleeding at the moment, then that's a precaution we'd want to think about. Another precaution that is really important is anything to do with a spinal puncture, a lumbar puncture, or a patient that might have an epidural in, and the epidural is going to be coming out soon. So it's important for nurses to know that if they were on the ward and the team came around and said, okay, take the patient's epidural out, and the patient was on subcut heparin BD, then we would want to alert the team to that, and we would omit that dose. We would just write withheld on the medication chart and give the reason of epidural removal. So we'd want to get rid of that dose, and that's an important one for students to know about, because of course if we were to give heparin and then we took the epidural out within that specified time frame, then the patient could have bleeding from the site when it's removed, which could cause a hematoma around the spinal cord, which could cause some temporary paralysis. So that's the reason there. Okay, so in terms of adverse, obviously if the patient was hemorrhaging, meaning they were bleeding, that would be an adverse event. Interactions, we want to know that the student can look through the rest of the med chart and just be confident that the patient isn't on any of these other drugs. In terms of Margaret Cunningham, for example, she is actually on aspirin, but she's on sort of a lower dose of aspirin. She's not on a high dose of aspirin, so it's not going to interact here. Whereas if you had a patient that was on warfarin, obviously we wouldn't be giving subcut heparin here. And that's pretty much all we're looking for in the MIMS. We're not looking to see what packs it comes in or how much it costs or anything like that. We're just looking for the use, the contraindications, the precautions, adverse events, and the interactions. So that's that book there. The next book that I want students to look up is the Injectable Drugs Handbook, and we're only using this in first year as just an introduction how to use it. In second year and in third year, they'll be using this a lot more frequently. So this book is easier to find. It does have an index at the back, but it is all alphabeticalized. So if we were looking at heparin sodium in this, yes, it does still give us the fact that it's a drug class anticoagulant, but it doesn't give us the same information that the MIMS gives us. It tells us the different brands that might come in, which is the Pfizer brand, the DBL. It tells us it comes in heparinized saline. It also comes in bags of saline. But it's what we're looking for here is what availability do we get the drug in? So it comes in 1,000 units in a mil, 5,000 units in 0.2 of a mil, 5,000 units in 1 mil, 5,000 units in 5 mils, or 25,000 units in 5 mils. The student needs to know here, what one are we using? It's not just the fact that this is the one that we're getting off the shelf. What one do we need to give to our patient who is having their BD subcut heparin, and why? So what they're looking for here is how are we going to administer the drug? So if they go down to this part here where it says administration, we'll look at IM injection, not recommended due to the risk of hematoma. That's obvious, and that was in the MIMS as well. We want to look at subcut injection. That's what the order says in ICP. We're giving it for subcut, so what one do we use? we inject it undiluted, and we use 5,000 units in 0.2 of a ml concentration, and we rotate the site of injection. That is all. That is all. We're looking for this book to be using it for teaching in ICP. I hope that's really helpful, and I hope that puts everybody on the same page, and hopefully we can, the students will find these books a little bit easier to use moving forward. Thanks. Bye.